Ever wonder what motivates people to get plastic surgery? Did they regret it? What can we learn from the plastic surgery stories of real patients? I'm Dr. Sajan, and this is the Plastic Surgeon Podcast. Hello, my friends. Welcome back, and thanks to our listeners for the amazing feedback we have had and all the fun we have had. We look forward to more of your insights and suggestions. Please rate and review us on Apple Podcast. To help us get you more amazing content on the Plastic Surgeon Podcast, we share real patient stories with you. We share stories of pain and triumph, and we go into the details of what motivates people to risk their life under the knife. I'm Dr. Sajan, and my guest today is the wonderful and amazing Ember. Hi, Ember. We're here to talk to you about your journey, how we came to know each other, your procedure, and how it's affected you so far. Ember, tell us, what surgeries did you go through with me?
Hi, Dr. Sajan. Yeah, I had a couple of surgeries with you on two different occasions. I had facial feminization surgery, and I had breast augmentation surgery.
Ember, what's facial feminization?
It's a process of taking a face that's more masculine and doing surgery to it and changing it into something that's more feminine and matching my personal inside feelings.
Ember, what motivated you to have that surgery?
I am transgender, and I really wanted my external appearance to resemble how I feel inside. And following facial feminization surgery really brings that internal feeling outward.
Ember, where are you from?
I was born and raised in Northern Idaho, and I went all the way through high school in a small town called Kellogg.
Did you have siblings?
No, I'm an only child.
Did you grow up with both your parents?
I did, yes.
How was your experience growing up in Idaho?
Well, back in the 1980s and early 90s, it's a little different than today. Being transgender and coming out during that period of time is a bit more challenging. Exploring one's expression wasn't as open as it is today.
When did you have the sense that your gender assigned at birth wasn't congruent with your gender identity?
Oh, that goes back a long ways. I can remember back to being 5, 6, 7 years old and wondering why I was born the way I was, that my parts didn't match who I wanted to be. And I would daydream or imagine that I was somebody else. And that expression would come out subtly. One of my friends was female, and I was occasionally allowed to put on their dresses. And that was such an euphoric experience. It was something that was really rewarding, but not something that was really encouraged.
And what age were you when you were trying on your friends' dresses?
Probably 7 years old.
Wow. So at the age of 5 to 7, you were having these feelings.
Yeah, absolutely.
Did anyone else know around you, like your parents or your...
No, I wasn't. It really wasn't the environment to come out and say something like that, nor was there any representation to really understand what those feelings were. Not like in the media or in, representation today, where people are actually willing to come out and talk about this type of stuff. Society was much more repressive at the time, and there wasn't any representation for me, let it be, people that I knew around me that I could relate to and express that. I was born male at birth. To be able to walk up to my parents and say, or any of my other family and say, oh, I'm a woman, I'm a girl. It didn't relate to anything that I thought I could say.
How did you happen to put on your friend's outfit then when you were 7 years old?
It was more like playing dress up.
So you were at her house and you just took her dress and put it on?
Yeah, pretty much.
Did you show anybody or no?
Maybe her mother saw, but that would be it.
Did your parents know about this?
I don't know if they did or not. I've never asked.
When you were in 5, 7, 10, did anyone get the feeling that your identity wasn't congruent with your gender assigned at birth?
I mean, I was a bit of an odd child, but I think it was more just chalked up to being a little different than
Mm,
gender expression.
how were you odd?
I guess it was odd is such a general word, but it would be that kind of expression of underlying femininity, if that makes
It
sense.
does.
It was like almost bubbling to the surface, but then I would push it back down again.
Mm. When did you first yourself get a sense that when did you start understanding that there was incongruency?
I would say it was in school and that I wanted to hang out with the girls more than the boys, but girls
Yeah.
have cooties.
What age
So,
was this?
oh, that would have been like probably third through fifth grade.
Mm. And how did you start learning about gender, the spectrum of gender?
Oh, that would be much later.
Mm.
Um, I definitely buried all that away,
Mm-hmm.
especially when in, say, middle school.
Mm-hmm. Mm-hmm.
Coming back to that being odd part,
Mm-hmm.
um, I received a lot of, we'll call it negative attention, bullying
Mm-hmm.
in middle school. And
What was that bullying about, that you were more feminine?
probably, yeah.
Mm.
Um, and I learned that if I expressed masculinity as a very strong trait, I didn't get that same negative feedback.
I see. And when you say bullying, was it name calling? Was it hitting? What was it?
It wasn't much physical. It was mostly, name calling and that type of stuff.
And that's probably worse than when you're in school.
Sometimes I wish I'd have just gotten in a fight and moved on. Yeah.
Yeah, yeah. Um, and then after middle school, you went to high school.
Yeah.
And during that time, did you have um relationships with people who were more female assigned at birth?
Yeah, definitely. I fully fell into being in the male role
Uh huh.
and had female relationships with female assigned at birth.
Uh huh.
And you would say that looking appearance to society that everything looked normal,
Uh huh.
if you want to call it normal,
Uh
and that
huh.
I fit the standard gender roles.
How did you feel in those relationships?
It was okay.
Did something not feel right, or just part of the flow, normal life?
No, I wouldn't call it normal life. It would be
Mm-hmm.
more like I would want to be that person, if that makes sense.
Mm-hmm. When you
But
say that person, was it that person that you were dating or in a relationship with, or be that role you were pretending to be?
I would have wanted to have been the person that I was in the relationship with.
Oh.
Yeah, it's not something that I think I've ever mentioned to anybody than right now.
And did you ever tell your partners that this, or
Oh,
did
no.
they ever pick up on this or no?
No. Mm-mm. None of this came out until recently.
Yeah. And so you were classic male, if you will, if I can say that
Yeah,
word, and you
absolutely.
were living life in Idaho.
Mhm.
Then you finished high school, everything being hunky dory, if you will, right?
Oh, yeah, absolutely.
No one had
But
anyone have a sense in high school?
no,
No.
well, I would say no.
Mm-hmm.
Looking back on it, maybe there was signs, but no, not for the most part. I think the general populace in the school and whatnot would have said, "Oh yeah, Ember is a boy and they do boy things
Mm-hmm.
and no questions asked."
Did you ever have any relationships with people who were assigned male at birth?
I haven't. Not for a lack of interest
Uh-huh.
that I chose not to pursue though.
Yeah, understand. In high school, nothing like that either.
No, 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 no.
After high school, you went to college.
I did, yeah.
Where did?
University of Idaho.
Oh, cool. So you stayed local.
I did. A couple hours south. That was it.
How did you like it?
The University of Idaho is nice.
Yeah.
It's kind of an oasis,
Mm-hmm.
if I were to say, for learning about yourself.
Mm-hmm.
A lot more accepting. even though I chose to not explore that stuff.
Mm-hmm.
It was an opportunity, squandered, I guess.
What was your major?
Computer science.
Yeah. You liked it?
I do. It comes back to our discussion about AWS and moving technology, right?
Yeah.
I've always been a bit of a nerd that way. I
Uh-huh.
got into computers whenever I was barely in high school.
Uh-huh.
And probably as a side effect of, having a non-congruent gender, computers never judge you, right?
Mm-mm.
And you can invest almost an infinite amount of time into them. And I kind of did that.
Oh, that's cool. I remember I was really into computers. I had a 386 Pentium, if you remember what that is.
Oh, yes. 386s, 486s, the Intels. Oh, I think I have a couple of those chips in a drawer still.
Oh, yeah, yeah. I remember using DOS and doing all that stuff. I don't think a lot of our viewers are going to know what that means.
There might be a few of them that, played with DOS and Windows 3.1. There could be someone of my age floating out there looking for facial feminization surgery.
Oh, God, I remember Windows 3.1. We used to call it wind blows because it used to blow up all the time.
Oh, it crashed all the time, or it would say it was out of memory.
Yeah.
I mean, why is it out of memory? I have nothing open.
After college, where did life take you? What did you do next?
Yeah, so after college, I went and started my technology career. I worked at a regional credit union out of Spokane, and that was pretty much adulting.
What made you want to leave Idaho and go to Spokane?
A little bigger town.
Mm-hmm. Mm-hmm.
Yeah.
And how was that?
It was better.
Yeah. What did you like about Spokane?
I knew some people around there. I was comfortable with the city because I had spent, time growing up in the area.
Mm-hmm.
And I liked working at the credit union. It was a good fit for me at the time.
Were you helping with their IT systems? Or?
Yeah. So I was a systems engineer, systems architect. And so I worked in the IT group and designed and maintained computers.
So did you with their software?
Yeah, exactly.
Okay. So they had custom software that you were helping make sure it worked. Is that correct? Or?
It was a lot of pre-built components that you assemble. Like you purchase a software product and you integrate it with the rest of the software products, and then all of that communicates in and out of the credit union.
Yeah. And when did you start learning start expressing more that your gender wasn't congruent with your gender assigned at birth?
Oh my gosh, that was later.
When?
Oh, we would have to flash. We'd warp forward. Well, now I'm jumping around.
Mm-hmm.
About age 25, 26. So it would have been about during the credit union time.
Mm-hmm.
I would travel to Portland to visit family. And when we'd go out, I would be approached by either sex. And some of those same-sex approaches were very appealing, but I always turned them down.
And where were you going at? Were these clubs? Were these restaurants, bars?
Like clubs, bars, arcades, that kind of stuff. Yeah. And whenever I was approached, it was one of these things where you're like, "Oh, thank you," but I don't go that way.
How would they approach you? Other men?
Oh, just different ways. Come up and say hi, or touch you like on the shoulder. Hi. You want to grab a drink, something like that. And
were these places more where people would go to attract?
It would be totally acceptable.
Yeah. Okay, got it.
Being approached in one of these places wouldn't have been odd at all. Right.
Understood. So you were gravitating a little bit towards that environment.
I think so. Yeah.
And were you with your friends or did you go alone?
It was always with someone. Yeah. I never did it by myself.
I see. So it sparked an interest.
It did.
Did when people who were assigned women at birth, when they approached you, did that spark an interest or not really?
I was oblivious to it. Like every other woman, doesn't click for some reason. But
when men approach you, that sparked something.
Yeah. Not only did did it spark something up here, but I acknowledged it immediately what was happening.
And then how did that move into something more?
Well, here's the wild part, or the part that like I'm disappointed in myself with, I guess, is I had those interactions and that would have been my late 20s and
Mhm.
early 30s. And then I repressed that side of myself.
Mm.
It's like I doubled down on trying to be what was expected of me.
Why do you think you did that?
Sometimes in life, you get to a point where you're like, oh, I'm 30 years old. I've done this for so long. Why am I thinking differently? Why would I change what I'm doing now? Obviously,
Mm.
it's worked up to this point. What do you mean? Reset your life and start over.
Mm.
And there's this squirrel in the back of your head that says, I'm different. I'm different. I'm different. And then you're like, squirrel, go back in your cage.
Did you ever get any family pressure about, oh, why aren't you married? Why don't you have this? Why don't you fit this classic pattern? Or your parents weren't saying any of that?
So I've actually been married twice.
Uh huh.
Once actually right out of college,
Uh huh.
and that didn't last very long. And then I've been with my current partner for 10 years.
Oh wow.
Yeah.
And the first, you don't have to talk about it if you don't want to. What happened with the first marriage?
Uh, Getting married too early,
Mm.
and one of us was still in school, and it was just a bad match altogether. It didn't even have to do with like gender incongruity or anything. It was just too early, jumping in too young.
Did you all have a big wedding, or was it something just
It was too big for how short the marriage was.
Oh no! How long did it last? A year or less?
Yeah, yeah.
And then and that was to someone who's assigned female at birth, correct? And
was.
presented female.
Mhm.
And then that didn't work out. And then when was your second marriage?
That would have been 2014.
Ah, I see.
Yeah,
And who's? I'm not asking for the name, but is your partner assigned female at birth, or
they are.
they are? And you were presenting male at that time, is that correct?
Correct. Yes.
And there was none of the gender none of the gender stuff was there, correct? If you will.
No. The answer is no. But what's kind of, I guess, sadly entertaining is when the two of us look back at my own behavior
Mhm.
and answers to questions that my current partner has,
Mhm.
asked in the past. They're just like, it was so obvious. The answers to things that I've asked you were just like things I never thought of.
Mhm.
And so, like different discussions that you have, some of them aren't, podcast appropriate, but the answers that I gave were things that made them go, well, that doesn't make sense in this marriage, but okay. And it was brushed off at the time, but after I came out, it became a lot more obvious.
And you have children?
Uh, Two stepdaughters.
Oh, awesome. That's great.
Yeah.
And so you got married in 2014. And were you in Spokane at that time, or had you moved somewhere else?
We were technically moving from Spokane to a small town by the name of Colville,
Oh, where at? Washington?
Washington. Yeah, Colville's
Uh-huh.
about an hour and a half north of Spokane.
Mm-hmm.
And for some reason, we decided to move to a small town, even though both of us didn't liked Spokane. I had a job opportunity up there and was like, well, we'll go try the rural life out again.
Was it more IT stuff?
It was, yeah. Yeah. I was an IT manager up there for a manufacturing company.
Oh, cool.
Yeah.
And how did you like that?
It was great. Yeah. I loved leading an IT group and, the vision of technology within an organization.
Mm-hmm.
Yeah.
That's cool. So 2014, you got married. You made this move, and how was life? How was life at that point?
It was good. Yeah, it was good. As far as like gender playing into it, it was pretty packed away at that point.
Mm-hmm.
I mean, it was buying a house, moving family, starting a new job. Like those were the focus points. And so anything that had come up gender wise really went into the back burner at that point because I was the male role of the family, executing on that to like a high degree. And therefore, there was no room for expression. But I think that was setting up for what was going to happen a few years later.
Were your stepdaughters with you at that time, or were they shared, or how was that situation?
It was a shared situation.
Okay, and that was working okay.
Yeah.
And you and your partner seemed like you had a really strong relationship. Is that right?
Oh, yeah. Yeah. It was fabulous.
When did you start expressing or conveying to other people that your gender wasn't congruent?
I think actually telling somebody about it was like the breaking point. So we have to look, it's like a working backwards situation. And there was Ember buried deep inside that started kind of expressing themselves in subvert kind of ways. Let it be slightly different dress, or the music that I listened to, or maybe the shows that I watched. That started coming out a couple years before I actually came out.
What kind of music were you listening to?
So there was definitely some bottled up aggression, right? And so, like, through my late 20s and early 30s, I listened to some, like, heavy metal and just very intense kind of music. And then as the gender started breaking through, it was a lot more pop and dance and things that make you want to move. And it was really almost a battle of music was an expression of what the battle that was going on inside myself, if that makes sense.
It does.
And then there was clothing, and it was clothing that I could cover up that was starting to change. And my partner was kind of curious about why these other articles of clothing were coming about.
What kind of articles were they?
Thongs and such. Tops, but things that can be covered, right?
So you were wearing more quote unquote traditional clothing over these items.
You got it, exactly.
Yeah.
And that's whenever, like, you could start to see the mystery start to show up my partner.
Yeah.
And
what did your partner ask you?
They were like, "This is interesting," and I'm like, "Yeah. Don't worry about it."
Just ignored it, and then your partner didn't push it any further.
They didn't. They were very kind.
That's really amazing.
Yeah.
And how long? And what happened next?
I would say that went on for, I never journaled this, but maybe 10, 12 months, something like that. And
how did it feel when you wore a thong or
gender affirming clothes of some sort?
Yeah,
it was, on one side, you want to say that it was affirming, but really what it did was it was almost like a pressure valve, right? Because I had this internal pain, or people like to refer to it like it was really a pain or an agony that was trying to get out. And that clothing was kind of like a relief valve that let that happen for a while. But at the same time, it affirmed what the challenge inside of me was. And then in around Thanksgiving time of 2020 was when the wall broke down inside of me. And it's like, I have to deal with this. I have to face it. What's next? And
so this was an internal conversation you had with yourself.
Absolutely, yeah. I was not going to express this to anyone else until I figured out what was going on. And you know how, like, the world of Google has led to self-diagnosis, which is good and bad, right? Google is a world of infinite knowledge, but at the same time, it's like it's also caused a discounting of need for professionals for diagnosis, right? I mean, I'm sure you see it in your practice, but I mean, I think with mental health, it's huge as well. Because going to, like, a mental health specialist, it has a lot of a stigma, at least in the United States. And so I didn't pursue the mental health route until I had already reached a breaking point, essentially, right? I would have loved to explore that 15 years ago, or even 10 years ago or whatever that was going to be. But I self-diagnosed to the point of like, yep, that's me. And I knew all the pieces going in, so it was not a surprise. And it was one of these things where it's like, it wasn't like, oh, there I am. I had seen other transgender women and transgender men transition and know that I am envious of them.
Where did you see them transition? Online?
Even not only online, but people that I knew from college ended up transitioning years later, and watching them watching them post their stories online,
like Facebook or something like that.
Yeah, absolutely. And so
people from Idaho.
Yeah. And
why do you think you felt envious?
Because I wanted to be them.
Did you tell yourself this, or did you just have like an internal like angst, if you will?
Internal angst.
You couldn't convey that. You couldn't say those words to yourself.
Yeah, because that would be admitting everything I fought against my entire life.
When did the word "I might be transgender" pop in your head?
To the point where I would admit it to myself and say it to myself.
To the point where you suppressed it.
I think there's a disconnect there, because I want to say that that thought of might be transgender goes back, a few years before that point in 2020. But when I was willing to admit it to myself was really in 2020. When I was willing to say, yes, this is me. This is what I've been thinking and repressing. We need to pull it forth, address it, and admit it.
Did something happen that made you say that? Or was there an event?
Yeah, so that's where it starts getting a little bit darker, right? And for those that want to skip over it, this is, a trigger warning for suicide, right? And I'd always had those ideation thoughts going all the way back to puberty, right? When the body changes and you go from being a child into a man or a woman, and those characteristics come out, that was a difficult period, right? And I had access to weapons whenever living in Northern Idaho, and I had safety training in them, and so that was perfectly fine. But my brain also understood how to use them on myself, and those thoughts came back in a very different way in 2020. And I realized that one of two things was going to happen if I didn't do something. Like, I either had to do something about this internal struggle, or I was going to solve it another way.
Was that the first time you had thought about suicide?
To that degree, to the point where it's fully planned out.
So you planned it out. You would take a weapon and hurt yourself.
Yeah.
And you had a weapon with you.
I have a number of them, yeah. So, and it was one of these where...
Why did you want to do that?
I didn't want to continue living the way I was.
What was making you feel like I don't want to live?
Whenever you repress who you are for long enough, you don't ever feel like you can be truly happy again.
Were you not feeling emotion from life?
It starts to go away to the point where you don't feel anything. Yeah, it's weird.
So you had no feeling. Were you sad? Were you depressed?
Mine was a lack of any feeling.
So you felt like there was no point in being around. Is that accurate?
Yeah, there was absolutely no point except for this growing anger. And the anger then became directed at myself because I wouldn't fix it.
So correct me if I'm misstating here, but it seems to me that you felt angry at yourself because you had no feeling, and that anger wanted Ember to hurt Ember.
Absolutely. And I would actually take it one step further. And this is not like a split personality or anything. It's like Ember, if Ember couldn't come out and be Ember, Ember was going to take care of previous person, even if it killed Ember in the process.
And you said this was around Thanksgiving time?
Yeah.
And were you around family when this happened, or tell me what was the scenario?
Yeah. Of course, I mean, I had access to dealing with it at home, and just the thought of going through another series of holidays as
Were you in Idaho at this time?
no, I was in Colville.
Okay.
And so just going through yet another series of holidays and faking my way through it, I didn't want to do it anymore. And we just, experienced COVID and the lockdowns and the time to kind of reflect on a society that wasn't really working that well, right? And it's one of those things where you're like, is it? Yep. So when are we going to do this? And then it's like, well, you have another way to deal with this problem. So it was actually a Reddit post, and this particular post, I wish I would have saved it because I could never find it again. But the individual was essentially the same kind of situation that I felt that I was in. And they're like, I came to the end of the road and I could either stop walking or I could go down a different path. And it's like, well, yeah, that's a really obvious solution. But whenever you've been wallowing in it for so long, it seems profound. And for anybody who's listening to this right now that's hit the end of the road, there is another solution. And that's to reassess life. And if you are transgender, to transition.
And this hit you all together in that time period.
Yeah, it was very quick.
And what was the first thing? Who was the first person you talked to?
So my spouse and I, we always had a rule that we weren't ever going to keep secrets from one another. And I didn't sit on it for very long because I knew that this was something that I had to deal with, and in a pretty rapid set of, in a pretty short timeline. And so I wrote them a long text message.
Really?
And I sent it.
Can you summarize it for us?
Yeah, it's basically like, I've spent a lot of time thinking about this. I've repressed it for a very long time, but I am transgender.
Wow. And some people that I've had the privilege of meeting, they'll go through this spectrum, if you will, where they'll understand the gender isn't congruent. Sometimes they'll identify as gay, genderqueer.
Yeah.
And then with more exploration, they'll feel or understand they are transgender. For you, that wasn't the case. It seems that you understood that you were transgender through these many years of life, and that's where you went. Is that correct?
Yeah, and this type of behavior is pretty common for me. I think about something a lot before I do it, and then whenever I do it, it's very intent. It's driven, and we get to the conclusion.
I get that. Ever since I've known you, you are one of the most insightful people I've had the privilege of talking to.
Oh, thank you.
You come across as very nice, very kind, not passive, but I'll understand and I'll be nice about whoever you are. That's the feeling you give me.
Yeah.
But deep inside, you understand, you assess, you think, and you make decisions. And but you convey it in such a non-threatening, non-judgmental way. It's really remarkable.
Well, thank you.
I think I have a feeling, maybe I'm wrong. I bet people sometimes underestimate how truly insightful you are as a person. Because I think you come across so nice and accepting. They're, oh, that Ember's nice. Ember's cool. But Ember is a lot more than what you see. Not in a bad way, but in a understanding, insightful, depth of knowledge kind of way.
I think that's a fair assessment. Yeah. I think that my colleagues would say the same thing.
Mm-hmm. How did your partner respond initially to this?
Actually, they've been really fabulous.
Mm-hmm.
It stunned them, but at the same time, they've been very caring, very kind, very accepting.
Did your partner say, I don't want anything a part of this? Or did that ever come across? I didn't sign up for this type thing.
Well, they did say that they never signed up for it, but they were fully behind me the whole time. And they've been 100% supportive all the way through the process, and they've been by my side.
What was the first action you did after you and your partner? So I guess you all met and talked, I'm assuming.
Yes.
And did you have a thought or feeling that your partner would leave you because of this?
Oh, I think that most folks that come out, let it be queer, transgender, or somewhere on the spectrum, there's always the fear that everyone's going to run away from them because they read stories online. I mean, history shows that it's a challenge.
Absolutely.
And I'm no exception to that.
And what you and your partner talked that day, I'm assuming?
We did, yeah.
And your partner, did they convey to you that I'm in it, or where did it go from there?
They said that they were, very accepting, and they were going to help me in any way possible and stay by my side. But it was going to take them some time to process.
Mm-hmm. Did you all stay together during this time?
Mm-hmm. Yeah.
Where did it go from there?
So I started transition at that point.
What does that mean? Socially?
So I started hormones.
Did you go to a therapist?
Yeah, therapist. I got on hormones. I started electrolysis. I mean, electrolysis takes for years, right?
Yes.
And I really just dove right into that.
How did the therapy go?
It was good. I have a great therapist. I'm still with him.
What did you learn the most from therapy?
That a person should be able to talk about this stuff openly and in detail.
And your therapist was affirming?
Oh, absolutely, yes.
Did your therapist specialize in gender?
They do.
And that's why you went there?
It is, yeah. I actually looked for a therapist specifically that understood gender, so that I didn't want to have to go through the education process, I guess you could say. I wanted to go right into okay, this is who I think I am. This is where I'm going. And I want you to either confirm or, what would be the other term? Deny?
Maybe dial back or something like that.
Yeah, exactly. Like, either I'm right or I'm wrong. And I want somebody that knows what they're talking about to be able to help me in like that path. Because I'm already like out of the gate. I'm a horse running. So if this really was a mistake, I need someone that knows the situation to be able to go, whoa, dial it back.
And were you in your small town during all this?
I was, but I went back to Spokane.
Oh, you did?
For therapy. Yeah.
Oh, I see. How about hormones? How did you find those?
That was actually online.
Oh, okay.
Yeah. I didn't want to have to deal with going back and forth to Spokane for that as well. Because small towns, as nice as they are, gender affirming therapy is not something that is easy to find.
How did hormones go?
It was smooth.
How did you feel different when you were on hormones?
It took about 2 months to adjust, right? First, to begin with, it's like a lot of excitement. You're doing this new thing. And then you start getting into the grind of it. But as your body adjusts, it's like really wild. Sometimes it's really emotional. Like your body's, of course, you've been on testosterone that it's produced forever, and then you introduce estrogen, and then you have too much of both of them, and then your body's doing this up and down thing.
Could you share with us what age you were when you started hormones?
Oh yeah, absolutely. I was 41.
Mm-hmm.
And so
What year was that? Do you remember?
yeah, 2001. So I was 41, started hormones. Within about 3 months, everything settled down, and I could just feel a lot calmer.
Did
Right.
the suicide thoughts go away?
Yeah. There was a little bit of, you question yourself a little bit on and off,
Mm.
um, especially whenever I'd get high.
Mm-hmm.
There's something about the exploration using marijuana that
Mm-hmm.
would make me really think about stuff, but I never, even after that deep thought, I never questioned that my path forward was good.
Did you start hormones before you talked to your partner? Because you said you talked to your partner in 2004, correct? 2004?
No. 2021.
Oh, okay.
Yeah.
And you started hormones in 2021.
I did.
Got it.
Yeah.
I see. And you said the suicide thoughts got better.
Yeah, they immediately started going down at that point.
I see.
I never had, by about 6 months on hormones, I really never considered it again.
After hormones, you did electrolysis. Do you start socially transitioning around that time or no?
I was on hormones for about 8 months before I socially transitioned, and it wasn't gradual. Same thing again.
Mm-hmm.
I started doing voice training as well.
Mm-hmm.
Well, about 4 months into hormones, and I did vocal training, and then at about 9 months in hormones, so at the end of September of 2021, I decided I'm tired of hiding. It's time to socially transition, and I literally I wrote up emails for work explaining what was going to happen. That
This is in your small town?
Yeah, and so I had already coordinated with HR, and I wrote emails and got it all ready because I wanted to handle my own coming out as far as work was concerned. And so I essentially sent my emails, I think it was like on a Thursday, and Ember came to work on Friday.
Wow. How were people with you?
Good for, I mean, it was one of two flavors, either very accepting or we don't understand, so we're just going to kind of ignore you.
Yeah, I can understand.
But there wasn't any, there was nothing that was like transphobic or outwardly negative about it. It was either positive or just neutral.
Now, I think sometimes, I grew up in the Midwest, but I think sometimes small towns get a bad rap. But
They do.
But I don't think that's always the case.
No.
Because people know you and they usually have a connection to you. And oftentimes that connection survives big change.
Yeah, and
Not always.
I ended up kind of being like a knowledge base for it, right?
Yeah. Wow. And and you were living in a small town. What about your parents? Did they how did you convey this to them or your family?
That was a bit of a challenge. I would say that if I could do that portion of, if I was going to change anything about coming out,
Mm-hmm.
it would be how I came out to my folks.
How did you come out to them?
I'm not going to jump into that one in too much detail.
Understand.
It didn't work out exactly how I had hoped.
Sure.
If I was going to do it differently, though, I would have written a letter
Mm-hmm.
with all of the details.
Mm.
I would have sent it and let them spend some more time with it.
Understood.
Yeah. There's some challenge in life. We don't do everything correctly.
No.
And yeah, that's about the only thing about coming out I would have changed.
Understood. And we don't have to talk about this, but do you still have a connection with your parents and family, or is it a little distant now?
It's mixed. Yeah, some members I'm closer to. Some are the same and some are more distant.
What about your mom and dad?
It's a mix.
Mm-hmm. Understood.
Yeah.
When did you decide to leave your small town?
So I stayed in that position in Colville after I came out and socially transitioned, legally changed all my documents like that, and then moved to the Portland metro about 6 months later.
Wow. And when did surgery start becoming a thing that you were thinking about?
Um, so I actually kind of intermixed one gender affirming surgery before I met you,
Mm-hmm, mm-hmm,
and I had an orchiectomy
mm-hmm.
and had that done in 2022 and moved to Portland or the Portland metro. And
So that's a really big step.
that was, yeah.
How
But
did you get there?
so I've I've kind of had some medical challenges downstairs for a long time,
Mm-hmm, mm-hmm.
and that's unrelated to gender.
Sure.
And so it was gender affirming surgery was almost the excuse I had to get rid of that problem.
Mm-hmm.
And it also like was the final thumbs up that this is absolutely the right thing for me. I never had another question in my mind once I woke up from that first gender affirming surgery.
And was that doctor specializing in gender surgery?
They were, yeah, in Spokane.
I've had some patients sometimes after orchiectomy have some reservations because they feel they weren't able to have erections or yeah, that was one of the main reasons they sometimes were like, well, I don't know if that was the right decision, but they don't regret it, but they think about it a little bit twice.
Mhm.
Did that occur for you?
No, not even the slightest. I mean, it resolved some of those underlying medical things that I'd had for a long time, but I refer to them as the evil twins. And so when they were gone, it was really amazing. I never questioned it again.
And after orchiectomy, well, you started thinking about facial feminization. Is that correct?
Yeah, it was actually I thought about facial feminization at the same time I was, around the same time as I got my orchiectomy, but I didn't have any coverage through insurance, and the out-of-pocket cost was too much at the time while moving and everything. And I moved, changed employers, and then my insurance situation changed as well. And so, being in a different environment, being in Portland, I really started broadening my search for surgeons and what could be done, right? In that narrow, smaller environment that I was originally, I didn't really think outside the box, right? What could I do? Who could I be? And then I started looking. Once I'd moved to Portland, I had seen a number of surgeons and online and stories and whatnot. And then I ran across your material, and I'm like, that's the one.
Really?
Yeah.
Why? What was so different about it?
It's interesting. I've been asked that question a few times, not from you and not even from your staff, from other trans people. And I don't know. It's like the way that you presented yourself that really resonated with my personality. And then that first day that we met, it was in your consultation room. And I was actually um, telling a couple of your folks earlier today is that I was brought in, I sat down, and you were busy with another patient. And I waited for a couple minutes. And in your office, you have a book that you've written about laser treatment. And I just can't sit still. So I walked over and I
Oh,
took the book
yes.
down and I
I
started
remember
reading
that.
it. And whenever you walked in, you looked at me and you looked that I had your book, and I set it down on your desk. And you didn't say anything about it. And we began the conversation. But beginning with reading that book, it was just like all of your online material is very professional, um, to the point, but also there's like compassion in the words. Does that
Mhm.
make sense?
Mhm.
And so whenever I met you in person, it just affirmed all the material that I'd seen before. And it's like, this is the person I want to do surgery. And we talked about how everything was going to be done. And the limited number of questions that I did have after that point, you answered them.
Mm. Why do you feel facial feminization was important for you?
Oh, so I only thought I knew why until I had facial feminization surgery. And it wasn't until after surgery, after we took off the bandages, and I looked in the mirror and who I saw looking back actually didn't trigger, it's a double negative, didn't trigger a sadness or a anger. It was like I looked in the mirror and I was like, "Oh, that's who I've always wanted to see looking back at me." And so it's from post-op backwards, I can really reflect on the features that changed, let it be my
Mm-hmm.
brow or my nose, my
Mm-hmm.
cute nose,
Yeah, your nose is really, really
my
amazing.
being able to see my eyes the way that they should be seen, even my chin, right? And recognizing how abrasive those aspects of my face were, now I know. But at the time, all I knew is I didn't want to look at that person in the mirror before. It was like the first thing you do in the morning is see something you don't want to look at.
Wow. Yeah, you didn't really put that in words until after.
Yeah, because I didn't really understand it until after, right? You can look at it and be like, "Oh, I don't like this," or there's something weird with my nose, or like, the chin is too masculine. Like, but until you see the result, I didn't know how much it affected my person.
Mm, I understand. What was important to you in finding somebody who could do your surgery other than what you mentioned? I know your compassion was important.
Mhm.
What else did you look at?
So, one of the things that I was concerned of was actually when the surgery is done, like, excuse me, something like nerve damage. I know we talked about that. Like, what are the worst outcomes that are possible? It's the IT person in me, right? Always planning for disaster, um, and not being, having some type of permanent disability or something like that. That was a big concern of mine. And when we talked about how your approach to surgery and understanding where nerves go, that's one example of something that just really resonated. Like, yep, he gets me.
That's cool. And you had a large surgery because we did full facial feminization, cheeks, nose, lips, chin, jaw, and we did a hair transplant at the same time,
Yeah,
which almost, I don't know anybody who does that together. So all in one, 16 hours of surgery. You stayed overnight at our facility.
I did.
I remember you had some of the most intense swelling in the upper lip I'd ever seen. Right? Tell us a little bit about how that experience was. I know you shared about looking in the mirror and feeling it was you, but how was the nitty gritty of healing and going through that?
Yeah. So I would like to preface it that you warned me about all the stuff that was going to happen, but not in kind of a this could happen. You said these are the things that are going to happen, including, and I'm going to point this one out, numbness down here because there's so much work on my jaw. So for those on the podcast, I have my fingers up to my lower lip, and there's still a little bit of numbness for a very narrow band for my lower lip. But you said you're not going to have feeling in your this little band in your lower lip for up to a year. And so I really appreciate the fact that you were very specific about that. And this plays into the preparation for the surgery, right? We talked through what was going to happen, with my brow and how that was going to be adjusted and put back in place, and how the hair transplant was going to go in, and um, the bandages that would be all over my face. But I remember this very specifically. I went, I woke up from surgery and there's a bit of restraint so that you can become conscious so you don't touch your face. Like that's the worst thing that can happen, right? And so both you and the um,
The anesthesia or the nurse?
thank you. I
Yeah.
was going to use words like the person who put you to sleep.
Yeah.
The anesthesiologist, you both explained to me what to expect. And after I woke up, I had a full head wrap. Everything was confined, and that was okay. And then you were to see me that Friday, the next day. And so we met in the afternoon, and I really wanted the bandages off. I really wanted them off. And you said, Ember, you don't want me to take those off. I can, but you don't want me to. It won't be the best result, and it's not an outcome either of us want. And I just breathed. I said, okay, doctor. And then I spent the weekend, bandaged it up, following all the instructions. But then you saw me on Monday, and we took everything off. And that's where, although I had an incredibly swollen upper lip,
I remember that.
we could see, I could see the changes already in my face because, as your instructions, I didn't remove any of the bandages. So I didn't have huge amounts of swelling under my chin or in my cheeks because the bandages remained in place, right? And I think that was a huge key into accelerating my overall heal because the upper lip swelling went down in about 4 more days. By the time you saw me at my 1 week post-op, my lip wasn't normal size, but it was pretty close. And other than bruising and a little bit of swelling, you could really see what Ember was going to look like 1 week post-op.
Wow. Do you feel I met your expectations?
Oh, exceeded them significantly.
That's awesome. Thank you for that.
Yeah.
Such a privilege to serve you. I can't tell you how much it meant to me and still means to me to see you. And you're still healing, right?
Oh,
You're still swelling. The hair is coming in. The nose is, now you're seeing the shape. It's coming in more and more. Cheeks are settling. The jaw takes a long time to fully settle because we change the bone and the skin has to heal to that. So everything is slowly coming in. We did the facial feminization and then we decided to do breast augmentation.
Yeah. Okay, so breast augmentation. I had limited breast growth from hormones, and I wanted a little more. And I was actually coming up for a facial feminization post-op appointment. And at that, because driving up from Portland to Seattle, it takes a couple hours. And somewhere along the process, I'm like, I'm going to ask Dr. Sajan about getting my breast aug and when we can schedule that.
Yeah.
So I knew that I was going to have it done for quite a while, but it was, once again, pretty spur of the moment to actually say, hey, when can we schedule this and do this?
That's awesome. Were you getting misgendered at all before the facial feminization surgery?
I got a lot of looks. So I think the only reason people would not misgender me is my voice is okay. If I would use my birth, my testosterone voice, I would have misgendered 100% of the time. So I got a lot of looks and occasional misgenders, but I really, I didn't feel comfortable.
After surgery, has that changed?
1,000%. I'm starting to stop even thinking about it now.
Wow.
I just moved through life the way I've always wanted to.
Have you been misgendered since surgery?
No, 0.
That's awesome.
Absolutely 0. I think if I would have to practice a little bit to lower my voice, but if I brought it back down, people would look at me really weird at this point in time.
You're such a beautiful person.
Oh, thank you.
Are you happy with the surgeries you've had?
I am. I'm happy with every gender affirming surgery I've had, especially the ones from you.
Thank you so much. What would you say is most different about your life now, having had the face and the breast augmentation now versus before? if anything?
Oh, it comes back to just being comfortable, both looking at myself and being comfortable in public. Because there's two aspects to life, right? In your private life, nobody else sees you, but you see yourself. Um, and in your public life, everyone else sees you, but you don't see yourself very often. And whenever you're interacting with people, it's difficult to get those looks and those misgenderings. Um, it's like being judged all the time. Now, I don't experience that at all. It just allows for a freedom of doing what I wanted to do, which is just be out and about, go to a restaurant, go for a run. I love running.
That's awesome.
Yeah.
Well, thank you, Ember. Such an amazing story.
Oh, thank you.
Ember, your story is so amazing. A story that's not typical, and I say no story is typical, because we all live unique lives. The journey you've had, I feel, gives a lot of insight to a lot of people. If there was one thing you could share about your journey so far, what would it be?
It would be that people be their authentic selves. Let it be in gender, life, family. Being who we are from a genuine standpoint is what's important. Hiding who you are, that it hurts you long term. It's something that you can, power through today, tomorrow, but long term, it comes back on you. And if nothing else, you'll regret it. But sometimes it can be a lot more serious. And that's what I ran into.
Ember, thank you so much for sharing your story. It's really been a privilege for me to get to know you and to serve you. You're an amazing patient, and I hope I can say you're also a friend.
Oh, thank you, Dr. Sajan. The feeling is mutual. I appreciate you having me on the podcast.
Thank you. Thanks for listening to the Plastic Surgeon Podcast. Please rate and review us on Apple Podcasts for more great content. And you can watch my live surgeries and adventures on Snapchat and Instagram at Real Dr. Seattle. Bam, what?